Welcome to another episode of Youth Diary. ENT is a specialty which deals with the problems of ear, nose and throat. And today we have Dr. Praveen with us. He is an ENT and head and neck surgeon at Lakshmi Hospital, Tripunithura. Hello doctor.
Hello.
Welcome to our show.
Thank you.
Doctor, can you just tell us what are the common problems that we see in youth?
As you have already mentioned, ENT department deals with the diseases of ear, nose and throat. When it comes to ear, the most common problems that patients come to us with are feeling of ear blockade, difficult to hear, ear discharge, and sometimes vertigo. By vertigo we mean so many things. It can be so many things, like giddiness, a feeling of being lost in the environment, feeling of spinning and things like that. And when it comes to the nose, the most common disease that we encounter is sinusitis. Then we deal with nasal polyps and certain difficult situations like CSF leaks, that is the leaking of fluid from the brain through the nose. And as an extension of our area, we also deal with diseases of the skull base like tumors of the pituitary gland and things like that. And when you come to the throat, the most common symptoms are pain of the throat, tonsillitis, change in voice, and there's a new area coming up like a professional voice, management of professional voice, like the voice problems affecting singers and anchors, advocates and people who use their voice a lot. And things. And another area is swallowing disorders, like patients who are bedridden with strokes. They will have problems like with difficulty in swallowing, and we deal with swallowing disorders and difficulty in breathing, usually caused by cancers of the throat, which later on present as difficulty in breathing. So these are the common areas where an ENT surgeon can help.
Okay. So doctor, we'll go to the questions.
Yeah, please.
Hi, myself Mahesh, doing MJMC at Ahmedabad School of Arts and Science. Now, my question is what is sinusitis? What are the symptoms? How can it be detected, and what are the possible management techniques to be adopted for the same?
Okay, so that's a good question, probably a long question, which I'll try to answer shortly. So before answering what is sinusitis, let me briefly describe what are sinuses. Paranasal sinuses are a group of hollow air containing spaces that are connected to the nose, and the lining of the paranasal sinuses is continuous with the lining of the nasal cavity, and it is lined by specialized cells which have a brush-like structure on their top. So these are called cilia. So the main function of the nose and paranasal sinuses are that help us to purify the nose, purify the air that we breathe in, and secondly, it maintains the temperature of the inhaled air to body temperature, so that depending upon the climate outside, it either heats or cools down the inhaled air to be that of the normal body temperature. And the third thing that happens through the nose is the humidification, that is, it adds to the moisture content of the inhaled air. So these are the main functions of the nose. And the paranasal sinus also help to reduce the weight of the skull, and in a way it protects the brain, so that when you meet with an accident, so it acts as a shock absorber, so that it protects the brain, and it takes up most of the force that patient especially in the case of an road traffic accident. And the third thing is it lends resonance to the voice. The normal voice that comes out through the throat is modified by the paranasal sinuses to give that final quality, so that jokingly we can say my voice and Dacetan's voice is one and the same, exactly the same, but the output, the final output, the final quality of Dacetan's voice is because of the structures of his paranasal sinuses. So in a way it lends resonance to the voice that comes out through the throat. So these are the main functions of the paranasal sinuses. And when the paranasal sinuses are infected or inflamed, this condition is called sinusitis. So normally around 700 milliliters of fluid secretions that we call mucus is being constantly produced inside the paranasal sinus.
That is a normal mechanism. Okay.
It's a very normal. Every day, every person produces about 700 ml of normal secretions that we call the mucus, and it is interestingly transported in a peculiar way to the natural opening of the paranasal sinuses to the nose. So we have four sets of paranasal sinuses. The one situated in the region of the forehead, we call it frontal sinus. The second one, maxillary sinus, is situated just below the eye on either side of the nose. And between the nose and the eye, you have the ethmoid sinuses. It is actually a group of sinuses and can vary in number, size and shape. So these are the ethmoid sinuses, and the fourth set is a sphenoid sinus, which we have just beneath the skull or the posterior or the posteriormost end of the nasal cavity. So these are the four set of sinuses: frontal sinus, maxillary sinus, ethmoid sinuses and the sphenoid sinus. So all these secretions that are being produced inside these sinuses is transported by means of the ciliary transport mechanism to the natural ostia of these sinuses. By ostia we mean small pores through which these secretions pour out into the nose. So when there is a block affecting any of these transport areas, there is a stagnation of secretion. When these secretions are stagnated, they act as a breeding ground for bacteria, viruses and other. So the normal secretions, that mucus, gets transformed to pus. So in this situation we call it sinusitis. So the main causes of sinusitis are two. One is infection and second is allergy. A lot of other factors also contribute to the genesis of sinusitis. Like as I mentioned earlier, all the transport mechanism as transport pathways from different sinuses meet at a common point within the nose. This important area is called the osteomeatal unit. And this is a junction where so many different types of diseases can be affected. Like there can be congenital abnormalities of the bone of that area, which might cause difficult blockage of this mucociliary transport pathway, which predispose the patient to sinusitis. So some patients who do not have these predisposing factors, it is very easy to treat sinusitis in those patients. But another set of patients who have these predisposing factors, we need to manage sinusitis in a more aggressive manner. So dependingly, we have two types of sinusitis. One is called the acute sinusitis and the chronic sinusitis. Acute sinusitis, it is usually seen as an extension of common cold. Like you have fever, headache, nasal block and watery nasal discharge, and when it goes on to become sinusitis, the pattern of the symptoms might change. Like the headache becomes more intense, the nasal discharge becomes more thicker, it will be more yellowish or greenish and sometimes blood tinged, and sometimes the patient might have throat pain. It can be associated with throat pain. So acute sinusitis is something which develops very fast, extension of the common cold, and presenting to the doctor with severe headache, nasal block, thick nasal discharge. These patients can usually be managed with medicines alone. So for the management of bacterial sinusitis we give antibiotics, and to reduce the swelling within the nose we give decongestants and antihistaminics and medicines like that. So with medicines most of them get cured.
So once it is diagnosed, how will you manage, doctor?
So acute sinusitis most often is managed purely with medicines.
Okay.
Like I mentioned earlier, with antibiotics, nasal decongestants, antihistaminics and similar medicines. One point I would like to stress in this situation is that you come across TV ads from different companies promoting nasal decongestants, promising nasal block free relief for about 12 to 24 hours. But the thing is that patients tend to use it very regularly, and it is not at all advisable to use such medicines for more than 5 days at a stretch.
Because these all are medicated ones.
Yeah, but the problem is that it lands us in a situation where it is called rhinitis medicamentosa. The medicine itself causing nasal block, and it is very, very difficult to treat such situations. So beware, don't use nasal decongestant sprays for more than 5 days. So that is very important. And chronic sinusitis, initially we try medical management, but as I mentioned earlier, due to so many other factors like septal deviation, nasal septal deviations and other body abnormalities that predispose those patients to chronic sinusitis, and patients who don't take timely medicines, those patients would require surgery. By surgery we mean the latest method of treatment is endoscopic sinus surgery. We call it FES, functional endoscopic sinus surgery. As the name shows, the main stress is on the function rather than the structure. We ensure that the sinuses are functioning properly. So we do that very little that is required to treat that patient. So conventionally people used to remove the entire septum to treat septal deviations, but nowadays we feel that it is not required.
Septal deviation means നമ്മൾ സാധാരണ പറയുന്ന
മൂക്കിലെ പാലത്തിന്റെ വിളവെന്ന് പറയുന്നത് നേരത്തെ ആ പാലം മുഴുവനായിട്ട് നമ്മൾ എടുത്ത് കളയുമായിരുന്നു. അത് തടസ്സം നീങ്ങും, പക്ഷേ അതിൻ്റെ ആവശ്യമില്ല. കാരണം നമുക്ക് ആ ഒരു ഭാഗത്ത് മാത്രം തടസ്സമുണ്ടാക്കുന്ന ആ ഏരിയ മാത്രം നമ്മൾ കറക്റ്റ് ചെയ്താൽ മതി. അപ്പോൾ വളരെ മിനിമൽ സർജറി, വളരെ സ്ട്രക്ചറിന് കാര്യമായിട്ടുള്ള വ്യത്യാസം വരുത്താതെ അതിൻ്റെ പ്രവർത്തനത്തിന് കൂടുതൽ നമ്മൾ ഊന്നൽ കൊടുത്തുകൊണ്ടുള്ള സർജറിയാണ് ഫെസ് എന്ന് പറയുന്നത്. ആ മ്യൂക്കോസിലറി ക്ലിയറൻസ് കറക്റ്റായിട്ട് നടക്കാൻ വേണ്ടിയിട്ടുള്ള, നമ്മളൊരു ഉദാഹരണം പറയുകയാണെങ്കിൽ ഒരു ഡ്രെയിനേജ്, നമ്മൾ എപ്പോഴും പറയും നല്ല ഡ്രെയിനേജ് പാതയൊക്കെ ഉണ്ടെങ്കിൽ എത്ര ശക്തിയുള്ള മഴ പെയ്താലും വെള്ളം കിട്ടില്ല. അതിന് പ്രോപ്പർ ഡ്രെയിനേജ് ഇല്ലാന്നുണ്ടെങ്കിൽ ചെറിയ മഴ പെയ്യുമ്പോൾ തന്നെ വെള്ളം കിട്ടും. അപ്പോൾ ആ ഡ്രെയിനേജാണ് ശരിക്കും നമ്മൾ സർജറി കൊണ്ട് ഉദ്ദേശിക്കുന്നത്.
Okay, and you talked about the surgery, doc. How much time it will take?
എല്ലാവരും ചോദിക്കുന്നൊരു ചോദ്യമാണ്, ഈ ഓപ്പറേഷൻ എത്ര സമയം എടുക്കും ഡോക്ടർ? യൂഷ്വലി നമ്മളൊരു പടം വരയ്ക്കുന്ന പോലെ ഒരു സർജറിക്ക് മുൻകൂട്ടി ഇത്ര സമയം കൊണ്ട് തീർക്കണമെന്ന് നമുക്കൊരു ധൃതിയില്ല. അപ്പോൾ നമ്മൾ പറയും ഒരു പടം വരയ്ക്കുമ്പോൾ അതിന് നല്ല ഭംഗി ഉണ്ടാവണം, അതിൻ്റെ ഫിനിഷിങ് വേണം. അപ്പോൾ ചിലപ്പോൾ അത് നമുക്ക് അരമണിക്കൂറിൽ വരയ്ക്കാൻ പറ്റും, ചിലപ്പോൾ 1 മണിക്കൂറിൽ വരയ്ക്കാൻ പറ്റും. അതുപോലെ തന്നെയാണ് ഓരോ സർജറിയിലും ഇറ്റ് ഡിപ്പെൻഡ്സ് upon ദി പേഷ്യൻറ്റ് ദാറ്റ് പർട്ടിക്കുലർ സിറ്റുവേഷൻ. ഒരു ആ പേഷ്യൻറ്റിൻ്റെ കാര്യത്തിൽ നമുക്ക് ചിലപ്പോൾ അരമണിക്കൂറിൽ തീരും, ചിലപ്പോൾ 2 മണിക്കൂറിൽ എടുക്കും. അപ്പോൾ നമ്മൾ ആ എല്ലാ സൈനസിൻ്റെയും ഉള്ളിൽ പ്രവേശിച്ച് എല്ലാം ക്ലിയറായ ശേഷം എല്ലാം ശരിക്കും ട്രെയിൻ ചെയ്യുന്നു ഉറപ്പ് വരുത്തിയ ശേഷമാണ് നമ്മൾ സർജറി സ്റ്റാർട്ട് ചെയ്യുന്നത്. സോ ഇറ്റ് ക്യാൻ വേരി ഫ്രം 30 minutes to about maybe 2 hours.
Like if everything goes well after surgery, like how many days a patient has to stay back in hospital?
Usually we discharge the patient on the next day, and patient can rejoin his work maybe in 2 to 3 days time.
What all they have to be careful after the surgery?
So for 3 weeks he has to be very careful because the healing takes place in 3 weeks time. So you have to avoid dusty areas when you travel through the roads. Better to use a mask and take the medications regularly and put the nasal drops for about 5 to 7 days so that all the swelling everything gets subsided.
Okay, doctor, are there any complications for sinusitis?
Usually in Kerala people are more literate, they are more aware, they get treatment. So the complications that we come across are very few, but the place where I did my post graduation we used to see so many complications. Like the disease focus in the sinuses can spread to other areas, like the most common being the diseases affecting the ethmoid sinuses. Now the important point to remember here is that the eye and the ethmoid sinuses are separated by a very thin bone. It is called lamina papyracea. അല്ലെങ്കിൽ പപ്പടം പോലെ അല്ലെങ്കിൽ പേപ്പർ പോലെ പൊടിഞ്ഞു പോകുന്ന ബോണാണ്. അപ്പോൾ വെൻ ദർ ഈസ് അക്യുമുലേഷൻ ഓഫ് പസ് and these thin lamellae of bone get destroyed and the pus and infection spread through the eye. So it can affect the eye, it can cause reduced vision or limitation of movements of the eye. So that is one eye complication. Second thing is that the plate of bone, a very thin plate of bone separating the nose from the skull, that is we call sieve-like piece of bone, that is called the cribriform plate. And through the cribriform plate the infections of the paranasal sinuses can get can ascend into the brain and cause meningitis, brain abscess like that. And these are most important complications of sinusitis.
Okay, so doctor, we'll see the next question.
My name is Roshni. I'm doing BSc Visual Media in Amrita School of Arts and Science. I wanted to know how is the management of nasal polyps?
Nasal polyps അല്ലേ, നമ്മൾ സാധാരണ പേഷ്യൻസ് പറയുന്നത് മൂക്കിലെ ദശ വളർച്ച. ദശ എന്ന് പറയുന്ന ഒരു ജനറൽ ടേമാണ്. അതിൽ പോളിപ്പ് ഉണ്ടാവാം, മറ്റു പല അസുഖങ്ങളുണ്ടാവാം. അപ്പോൾ സാധാരണ പോളിപ്സ് എന്ന് പറയുന്നത്, പോളിപ്സിൻ്റെ മെയിൻ ദർ ആർ 2 reasons for a polyp. One is infection and second is allergy or a combination of both, allergy as well as infection. So most commonly being allergy. So patients who are allergic, they are more prone to get nasal polyps. These are pale structures that fills the nose, and the main symptom of a polyposis is that the patient will not be able to appreciate smell. Along with the routine symptoms of sinusitis, when the patient feels that he is not able to appreciate smell, you should always think about polyposis, and it can be easily confirmed by a diagnostic nasal endoscopy. And coming to the treatment, there are 2 treatments. In the initial phases, when you can diagnose a very early polyps, in the very early stages, medicines in the form of intranasal corticosteroid sprays, that we call INCS. Steroid nasal sprays are the mainstay in the treatment of in the early polyposis, and also in the case of later on also. And the most important advantage of intranasal sprays are that 2 reasons. One, the dose is very minimal. It is only 1/1000th of the dose that we of a tablet. Okay. So a tablet എടുക്കുകയാണെങ്കിൽ അതിൻ്റെ 1/1000 ഡോസ് മാത്രമേ ഉള്ളൂ. Second is that target tissue is delivery of the drugs. ഫസ്റ്റ് നമ്മൾ ആവശ്യമുള്ള സ്ഥലത്ത് മാത്രം ഈ മരുന്ന് എത്തിച്ചേരുക, നമുക്ക് ടാർഗറ്റ് ആയിട്ടുള്ള ടിഷ്യൂസിൽ മാത്രം ഈ മരുന്ന് എത്തിച്ചേരുക. അതുകൊണ്ട് there is no systemic absorption and there are no side effects.
This is something like inhalers, right?
It is very much like inhalers. The only difference is that the particle size is 5 microns, so it will never cross the nasal barrier. It will not cross the nose. So the action is limited to the nose. It gives very sustained effect and it can be used regularly, unlike the nasal decongestant drops that are being advertised regularly in the TV. So intranasal corticosteroids can be used as sprays for a very prolonged period. I myself have been using it for past 10 years. So it is very safe and can be used for a very long time. So in later stages, when the polyp becomes too big to be managed with medicines or nasal sprays, the patient would require to undergo a surgery. Again, the name of the surgery is functional endoscopic sinus surgery. And with the help of the endoscope, we visualize the sinuses and get to the root of the polyps, that is at the point of origin of these polyps. And with the help of specialized instruments, we'll be able to clear all the disease, polyps, everything through from within the sinuses, and we can enter all the sinuses. All the sinuses can be cleared in one single sitting. And the most important thing is that as the main cause is allergy, there is always a chance of recurrence. So in such patients, when the cause of polyposis is allergy, we put them on post-operative nasal sprays. So it will help to prevent recurrence to tune of about 80%. The patient has to be on regular follow-up and the patient has to use the nasal sprays regularly.
So we'll see the next question, doctor.
Hi, my name is Amrit. I study visual media at Amrita School of Arts and Sciences. I'd like to know what are the instruments used in the endoscopic surgery.
Okay, so regarding instruments, there are a set of basic instruments and instruments used for advanced surgery. The basic instruments are an endoscope. There is a tube-like structure which has a facet for the attachment to the camera, and this endoscope comes in various sizes for the adult size as well as pediatric size, and it comes in various angles like 0 degree, 30 degree, 45 degree, 70 degree, 90 degree. By 0 degree, what we mean is that when you introduce the endoscope, you see whatever is there just in front of the endoscope. At 45 degree, we mean it helps us to see an angle with an angle. So the structure is placed at an angle of 45 degree. We will be able to see with the help of 45 degree endoscope. So various angled endoscopes and various sizes of endoscopes are available. Then you require a camera and fiber optic light source. And this will help us to visualize the structures within the nose through the monitor. So we look at the monitor and perform the surgery. So it requires a hand-eye coordination. So basically instruments are the endoscope, camera and monitor, with the help of basic instruments which help us to hold, cut and remove tissue, and a suction machine which help us to clear the operative field of blood. These are the basic instruments that are required. When coming to advanced surgical instruments, we have something called the powered instruments or the microdebrider, which helps us to do the same surgery very fast. It is a shaver system, whereas it cuts the tissues, it sucks it out, and it helps us to maintain hemostasis, that is it controls the bleeding. So microdebrider is an important addition in the list of endoscopic instruments. Then latest we have the navigation system, where it is just like the GPS that you use every day. So the navigation system helps us to locate the tip of the instrument. So it helps us to make sure where we are actually working. Sometimes we might get lost. So that is the importance of CT scan beforehand, because it helps us to get a proper idea of the anatomy. But sometimes if we have any confusion regarding the anatomy, so the navigation system helps us to know exactly at what point we are in. It will help us to be doubly sure regarding the anatomy, and it also ensures the safety of the patient.
So doctor, it was really an informative talk. Thank you so
Pleasure.
much. So that's all for today. Write your suggestion to us. Our email ID is youthdiaryrosewall@gmail.com. See you.